My name is Soheil. I'm one of the emergency department consultants. So I'm working in A&E. So basically, we have I think the ultrasound scan of the musculoskeletal quite useful and helpful to assess the patients in emergency department in some cases. So I chose this course just to get some idea about that and then apply it in the real life. So like for shoulder dislocation, how to actually diagnose with ultrasound scan, for the knee joint, fusion, also for the fractures, especially, distal, call it ulnar and the radius fracture. So these are the things so far I decided to use it in A&E. So I think 1 day course is good enough. You can practice later and then improve your skill. So that's the main reason I chose 1 day. And then if I need, I can expand it through the other courses. But this is the first step. Yeah. So far, it's been good actually. I think it's very helpful for emergency doctors. So I would recommend it. Yeah. It's the doctors in emergency department. There might be advanced nurse practitioners in emergency departments, possibly orthopedic doctors, more junior, or it may be middle grade one. Yeah, and probably physiotherapists.